The Edo State Ministry of Health held its 2025 Health Sector Joint Annual Review Dissemination Meeting aimed at assessing progress made in the health sector and planning for improved services. The meeting brought together key stakeholders including the Honorable Commissioner for Health, the Permanent Secretary of the Ministry, member of the State House of Assembly, development partners and health experts. The Honorable Commissioner for Health, Dr. Siri Adams Oshomole, described the meeting as a sign of the government's continued commitment to transparency and progress. He explained that the review was a time to reflect on past efforts, identify gaps, and plan create steps towards strengthening the health system in the state. He also restated the commitment of the governor to building a better and more responsive healthcare system for all residents of Edo State.
I would like to assure you that the Governor of Edo State, under the leadership of His Excellency, very distinguished Senator Monday Okpebholo, remains steadfast in his resolve to build a robust, equitable, and people-centered health system. We are committed to strengthening interagency coordination across all levels of care, enhancing data quality and usage in decision-making and most importantly, we are committed to listening and acting on the evidence that this review presents.
The chairman, House Committee on Health, Honorable Dr. Richard Edosa, spoke on the achievements made so far in the health sector and highlighted the steps being taken to improve service delivery and ensure better health outcomes across the state.
We have been able to rub minds on the number of health facilities available in Edo State and also plans on how to improve and increase those numbers so that we can improve healthcare delivery system to Edo people. We've also been able to look at data collection, which is a new goal. If we know statistics of maternal mortality, if we know statistics of infant mortality, if we know statistics of under 5 mortality, it will help us to know exactly how many of our children died in the previous year and how to ensure that such thing does not repeat itself. It will help us to know how many of our mothers died during childbearing and also will help to know what can be done to prevent maternal mortality rate in Edo State.
The representative of the National Health Insurance Authority, Dr. Theodore Ehanire, expressed their readiness to support the Edo State government wherever possible. He emphasized that their agency is willing to work closely with all stakeholders to increase access to affordable healthcare services, especially for the most vulnerable groups. Program Manager for UNICEF Lagos Field Office, Mr. Mohammed Okori, also shared his thoughts during the meeting. He said UNICEF is proud to be partner of the Edo State government in its efforts to improve the health of the people. He assured that UNICEF will continue to support initiatives that aim to make Edo State a leading example of good health practices in the country.
And we are proud to be associated and collaborating with the state government in everything they do concerning health sector reforms and all that. This collaborative effort is geared towards one thing, achieving universal health coverage, and that's what we are pursuing. It's an important step in the right direction.
This review is a crucial step towards strengthening healthcare delivery, assessing progress, and addressing key challenges through evidence-based decision-making. The recently released Nigerian Demographic and Health Survey NDHS 2023-2024 provides invaluable insights into the health status of our population in Edo State. It presents an opportunity for us to identify gaps, celebrate our achievements, and realign our strategies to improve health outcomes, particularly for children, women, and vulnerable population.
Director of Planning, Research and Statistics at the Edo State Ministry of Health, Mrs. Loretta Irobe, gave an overview of the two-day sector joint annual review process. She explained that the main objectives were to assess the state health sector performance across key indicators, identify gaps, and highlight areas for improvement. Also speaking at the event, the State Health Management Information System Officer, Mrs. Cynthia Amayo, addressed challenges faced in data reporting, performing monitoring and evaluation. She shared ideas on how to improve these processes for better decision-making and planning.
Strategic health development plan, which is now the HSSB, Health Sector Strategic Blueprint, which has 4 pillars. And one of the pillar has to do with having one conversation. So what we are doing today is having a conversation with all the stakeholders, health stakeholders, to understand our data so that we can together prefer a solution to what these challenges are, and then we'll have better health outcomes for the Edo State people.
The meeting ended with a renewed sense of unity among stakeholders and a shared goal of building a healthier Edo State through collaboration, accountability, and well-planned strategies. Irene Ejoba, reporting.